All right, Manitoba, welcome back to another episode, ladies and gentlemen. I hope you're having a wonderful day as always. Manitoba, I'm on all social media, so if you want to follow me on Facebook, Rumble, YouTube, that's Manitoba Freethinker Podcast. If you want to follow me on Twitter and TikTok, that's MB Freethinker. All right, Manitoba. So at a certain point, it's been over 100 days the NDP has been sworn in to govern here in Manitoba. At a certain point, we have to admit to ourselves, whether you're an NDP voter or not, that Wab Kinew is just all talk and no action. It honestly, Manitoba, it seems like he's governing like there's still the opposition party in Manitoba. They just go in front of the cameras and they just say whatever they think that the public wants to hear, whatever sounds right at the time. And it seems like they have no plan or action, no course of action to actually follow through on what they say. I'm going to bring you back to, I'm going to show you guys a video of what Wab Kinew basically wanted his voters to believe. Ask yourself, do you think that Wab Kinew has, had any sort of follow through on this?
So when I say tough on crime and tough on the causes of crime, what I mean is that when somebody does something wrong, we have to take them off the streets and hold them accountable. And when we talk about the causes of crime, I think we all know that it's drugs. For so many of the issues that we're seeing each and every day, it's drugs, it's addictions. And what have we gotten from Heather Stephenson as crime rates have gone up, as things feel worse than they were before they took office? Well, they've been hard on the people with addictions, but they've been soft on the drug traffickers. Something's wrong in that equation. So we will bring the hammer down on drug traffickers. We will crack down on the people who are bringing toxic drugs into our communities, the people who are breaking our families apart, who are robbing us of our loved ones. One step is to bring in an Unexplained Wealth Act. That'll mean if there's a gangster driving a $100,000 car, we're going to ask, how did you get that? And if you can't explain it, we will hold you accountable.
Mr. Lamont, last word.
All right. So do you guys think that he followed through on any of that? Tough on drug traffickers? I went over this article last show, but driver charged in historic methamphetamine bust in Bozeman, Manitoba, granted bail. Where is the tough on drug smugglers? From Global, the man charged in a historic drug bust at a land border crossing in Bozeman, Manitoba last month has been granted bail. On January 14th, the Canada Border Services Agency seized 406 kilograms of meth from a semi-truck crossing into Canada from the U.S. The meth was valued at $50 million and was equivalent of 4 million hits of the illicit drug. 200 packages of the drug were found hidden in a suitcase on the truck. The driver of the semi, 29-year-old Kamelpreet Sidhu of Winnipeg, was arrested and charged with importing meth and possession for the purpose of trafficking. Sidhu made his first court appearance in Brandon, Manitoba on February 1st. The judge granted him bail under numerous conditions, including paying $20,000 for the release and another $20,000 cash deposit in surety. His wife is also serving as surety, and a friend of Sidhu provided $100,000 in surety. While on bail, Sidhu is required to reside at his residence and has a curfew between the hours of 8 p.m. and 6 a.m. daily. He must also wear a GPS tracking device at all times, is barred from using or possessing any weapons or consuming drugs or alcohol. He is also only allowed to have one cell phone with no apps other than for calling and texting, and no software wiping applications. The court heard Sidhu was driving his truck from California to Winnipeg. The Crown said Sidhu told RCMP he didn't know what was in the truck, but they later found he had sent an image of inside his truck to his boss, showing furniture inside the truck. That was before when the meth was loaded inside, the Crown alleges. Sidhu's interpreter said to the court he says he didn't do that. The Crown alleges Sidhu made 3 suspicious stops and tampered with GPS tracking, and also stated Sidhu stopped in a less frequented area with no gas stations nearby where he picked up the drugs. The court also heard Sidhu had 3 phones, a Canada phone, a US phone, and another older phone. When RCMP officers plugged in this US phone, a 2-minute countdown automatically started, and then the phone was wiped clean. I mean, that doesn't say I'm innocent. Quote, a hallmark of a high-level drug trafficker, end quote, Crown attorney Matt Sinclair told the court. The Crown also argued over concerns about the gravity of the offense. Quote, too many Manitoban communities have been poisoned by meth, Sinclair said, also noting the dollar value of the amount of meth isn't the real issue. The human cost is what is truly staggering. This was enough meth for each human being in Manitoba to have 3 doses, end quote. Jesus. The Crown also noted Sidhu had made previous trips to California and alleged he is a well-trusted member of a... The Crown also noted Sidhu had made previous trips to California and alleged he is a well-trusted member of a drug trafficking organization. The defense argued Sidhu was a blind courier and was unaware of the drugs in his semi-tractor trailer unit, and the meth was loaded into his trailer without his knowledge, so he wouldn't act nervous or suspicious when he reached the border crossing. The defense also said Sidhu is a permanent resident who moved to Canada from India in 2014. I also went over this article that last show. 1.1 million worth of fentanyl seized at traffic stop near Brandon Police. So this again happened earlier. He already went, I believe, he made his first court appearance last Friday, I'm pretty sure. These 2 people, a 27-year-old man and a 23-year-old female, were charged with possessing drugs for the purpose of trafficking, and they were scheduled to make their first court appearance on Friday. That was last Friday. So, or maybe it's this Friday. I'm not too sure about that. But either way, Manitoba, this is what I'm getting at. Wab Kinew talks the talk. I just showed you a video of what he's going to do immediately if he was given the honor of being Manitoba's premier. And it's just all talk. We have record-breaking drug busts in Manitoba, record-breaking, and these people are making bail. The people that Wab Kinew literally said he's going to go against. So what does all this lead to? This all leads to a culture in Manitoba that believes that they have no criminal believes that they are responsible for their actions. That is what this has led to. Manitoba has gone on and on about, especially people of a minority, you're a victim. Even if you are the criminal, you are a victim. So this leads to a horrible story. Winnipeg parents charged with manslaughter in fentanyl death of 1-year-old girl. And the reason why I say that this leads to a culture in Manitoba that does things like this is because these 2 people, the parents, they had time to act differently. And they were thinking of themselves. Even if their daughter ingested fentanyl, they could have possibly saved her by taking different actions, but they chose to just protect themselves because our culture here in Manitoba is broken. And our media and our politicians do nothing to sway that opinion. So from CBC News, police have charged 2 Winnipeg parents with manslaughter after their 1-year-old daughter died of fentanyl intoxication in March 23. Gary Daniel, Adrian Bruce, 38, and Sabrina Faye Boulette, 37, were arrested at their home on Mackenzie Street on Friday, police said in a news release Monday. Constable Claude Chansey said the parents didn't call 911 until several hours after they knew their daughter, Hannah Boulette, had been exposed to the drugs. Several hours, Manitoba. This is their daughter, their own flesh and blood. This is mind-blowing to me. Quote, we do not need to see infants dying at the hands of irresponsibility, he said at the news conference at Winnipeg Police Headquarters Monday morning. Whether or not that person has an addiction or a substance abuse problem, this is inexcusable. I agree. The Winnipeg Police Service Child Abuse Unit started investigating the death on March 23rd after a man called 911 and told police his child had become unresponsive at their home, police said. Quote, it's something that they knew that the child was in distress at the time and could have called 911 prior to when they did, Chansey alleged. Winnipeg fire paramedics went to the home on Stella Avenue and gave Hannah CPR before she was taken to the hospital where she was pronounced dead. Both parents were arrested, though not formally charged, for criminal negligence causing death, and the man was charged with possession of a controlled substance after officers found a small amount of fentanyl on him when he was arrested. They were later released. Shocker. They literally poisoned their 1-year-old daughter with an illegal drug, and they're released on bail. There was an attempt not even released. They weren't even charged, for fuck's sakes. But there was an attempt by the parents to provide medical assistance to the child before police were called. Again, this all goes to show that they knew their child was in dire distress. And they chose to do, man, they could have just called 911 and still done all these things. And then just, took the drug charge on the chin. The parents had contact with police in the past and were using drugs when their child was exposed to fentanyl, he said. The parents and their child were the only people at the home. During the investigation, the parents gave little information about the child's death and offered details about the circumstances leading up to the girl's death, quote, that were not truthful, Chansey said. And toxicology reports released in June, and an autopsy found the girl died from, quote, high levels of fentanyl intoxication, end quote, police said. When that was determined, the Child Abuse Unit consulted with the Manitoba Prosecution Service about laying manslaughter charges. According to the province's Chief Medical Examiner, Dr. John K. Ewens, any amount more than a trace amount of fentanyl in a child can be fatal. The parents are now in custody. Manitoba advocate for child and youth Sherry Goat said news of how the child died is devastating. I've repeatedly called for government to develop a comprehensive mental health and addiction strategy, and the circumstances around Hannah's death reaffirm the need for urgent action, Gott said in a written statement. Again, comprehensive mental health and addiction strategy, to me that is literally just giving a cop-out for the people responsible. Quote, our hope is that those responsible for her death receive the supports they need to make positive, lasting changes so that this never happens again. My hope is that they're in jail for a very, very, very fucking long time for killing someone so this never happens again. Police are dealing with an increase in such cases across Canada, Chansey said. Last month, a 2-year-old boy ingested fentanyl at a home in Winnipeg. Quote, we know this society right now has a substance abuse problem. We still need to protect our children, so whether or not you have a drug problem, an alcohol problem, what have you, if you have children in your care, your first responsibility is for their safety. Well said. That quote I agree with 100%. Dr. Darren Markland, an intensive care physician at the Royal Alexandria Hospital in Edmonton, said it's up to parents to protect their children from anything they're exposed to, obviously. Children are vulnerable to anything that we expose them to, he said. Young children can put anything in their mouths, be it a drain cleaner or fentanyl. He also noted how toxic the opioid supply is and harmful it has become. Quote, even if this child was brought to medical attention rapidly with an unregulated and uncontrolled drug supply, the antidotes that we use may not have reversed this or saved the child. So there it is, Manitoba. Wait, just one sec. Oh, yeah. So, with all this, I mean, I didn't mean to laugh at that story. That is a horrible story. But this is, with all that set in mind, Wab Kinew's and the NDP's big, like line of defense is something that we I'm sure we all know, but they just continually talk about supervised consumption sites as the answer. So this was from a couple months ago. Quote, take our time, end quote. Kinew says, decision not made yet on supervised consumption site location. So the disappointing thing is they've made that plan. They've decided that they are going to go ahead with supervised consumption sites, but they just don't know on where. Manitoba government offered plan for Indigenous-led supervised consumption site in Winnipeg. The province says it's considering a community proposal for an Indigenous-led supervised consumption site in downtown Winnipeg. So while Wab Kinew claims that he wants to be tough on drug smugglers and drug dealers, his actions show that he just wants to make it easier and enable people who want to continue to do these illicit, very like fatal drugs. It's mind-blowing. The coalition behind the idea, led an Aboriginal Health and Wellness Center, includes community partnership Sunshine House, Kanichuk, Manitoba Harm Reduction Network, Main Street Project, and Substance Consulting. For more than a year, Sunshine House has been operating Manitoba's only mobile overdose prevention site out of an RV near Main Street at the Disraeli Freeway, offering drug users a place to test their drugs and staff trained to respond to an overdose. It's very exciting to be working in this type of landscape where you have community support, a provincial government that's really open to dialogue, to listening, Sunshine House Executive Director Levi Foy told CBC News on Tuesday. And that is the takeaway, Manitoba. We have a provincial government that's really open to literally, instead of cracking down on drug use. This is something the PCs were not going to follow through on. They were not going to have consumption sites. And think about it. Think about the location. What kind of clientele are you attracting to these supervised consumption sites of, again, illegal narcotics? These are all people breaking the law, but we want to continually make them into victims and say, oh, it's not your fault. But again, Manitoba, that leads to 1-year-old children dying in the care of these abusers. Well, like, what would have happened if this was a go? They just would have went and got their fentanyl tested at this supervised consumption site, and then went, because that's what it does. It tests your drugs, and then you go home and do it. You can do it there, but you don't have to. They could literally just supply you with the needles that you need, or, you know what I mean, the utensils that you need to do these drugs, and then you go home. No one is going to be forcing these people to do the drugs there. So this death of the 1-year-old would not have been prevented. So Manitoba, again, the thread of this show is Wab Kinew says one thing, and just with the complete disregard for any follow-up. So when he continues his listening tour, I kind of don't really have any faith in him anymore. Me personally, I think they should be doing a fixing tour and trying to fix our healthcare instead of just listening. Because again, they're just going to repeat what the nurses and doctors say, and the media is going to applaud that, and there'll be zero follow-through. There'll be absolutely zero follow-through. So, from the Manitoba government, at the third stop of the Manitoba government's healthcare listening tour, Premier Wab Kinew, Health, Seniors and Long-Term Care Minister Uzama Azuguera, and Housing, Addictions and Homelessness Minister Bernadette Smith met with rural healthcare workers here at the Selkirk Mental Health Care Center to hear their experiences on the front lines. Quote, fixing healthcare has to do with resetting the relationship with front-line healthcare workers, including those that deliver care in the rural settings, said Kinew. Our government promised to listen, and we're delivering on that promise. We heard the frustration workers feel after years of cuts and chaos. but we also heard the creative solutions to the challenges facing the front lines. We are working every day to step up and match the commitment of each frontline in healthcare. Earlier today, the Premier and ministers noted they joined a well-attended event with dozens of healthcare professionals, including nurses, physicians, and healthcare aides from Selkirk and surrounding communities, to hear their stories about working in rural healthcare. Quote, "What we saw in Selkirk was a fierce dedication to providing quality care," said Azaguara. "It was an honor to listen to the folks who are at the bedsides working hard every day to provide care and comfort to the members of our community. The concerns and creative solutions we heard today will directly inform how we improve healthcare. Together we could bring care closer to home for more folks in rural Manitoba." The listening tour will continue over the next several months with stops throughout the province, including the Health Science Centre in Winnipeg, Victoria General Hospital, Brandon Regional Health Centre, Bethesda Regional Health Centre, and Thompson General Hospital. Manitoba healthcare workers can also share their experiences and suggestions on how to improve Manitoba's healthcare system through Engage MB at engagemb.ca/listen to the front line. So, Manitoba, they say they're listening and they're, tough on healthcare, but what do we get? Patient dies after waiting 5 hours in St. Boniface Hospital ER. The Winnipeg Regional Health Authority is probing the death of a patient inside St. Boniface Hospital's emergency department. The WHRA confirmed the patient died early Friday morning. They had been in the emergency department for about 5 hours and had been triaged and receiving a number of diagnostic tests. But if you think that's bad, it gets worse. Death of person who waited 33 hours in Grace Hospital emergency deemed critical incident. I mean, obviously that should be deemed a critical incident. But Manitoba, this is Wab Kinew being tough on healthcare. This is his follow through. I've showed you what he says. Now I can show you his follow through. So Manitoba, when Wab Kinew is out on his Twitter account, nothing but smiles like he always is in front of the camera. Do you think that there's any follow through on what he claims is going to happen? So, like I said, he's all smiles. Good luck to all participants in at Seniors Care Seniors Games. The theme, "When Life Gives You Lemons Make Lemonade," reflects our commitment to unity in tough times. It's important we care for and listen to seniors, something we take seriously as we advance our efforts in senior care. So again, he's coming across as a big savior. I'll just play the video. All right, so that's what he claims that he's going to do for Seniors Health, but what does he actually do? NDP government puts Manitoba healthcare projects on hold. Facilities include Lactobani Personal Care Home announced and cancelled twice in 11 years by NDP and PCs. Manitoba's new NDP government, which promised to improve health care during the fall provincial election, is putting off plans for personal care homes and other healthcare projects as part of a broader review for provincial spending. Health Minister Uzoma Azagara said Friday, this is again an old article, said a number of healthcare-related capital projects are under review because of the projected deficit the NDP government discovered after it took office. So again, Manitoba, they say one thing, and their actions are never on par with what they say in front of the camera. Every single time they say one thing and do the opposite. So Wab Kinew is not tough on crime. Wab Kinew is apparently not here to fix our healthcare system. So I mean, when it comes to affordability, the only thing that Wab Kinew can bring up is the short-term tax break on our gasoline for our automobiles. That is the only thing, in my opinion, that I've seen Wab Kinew actually do. I will say, like last show, I talked about the funding for the school lunch program. I do agree with that. I know it's like a socialist program, but we do live in Canada. It should be a first world country. Assholes start off as shitty kids. And how do you become a shitty kid? When you're always fucking hungry. And if you have shitty parents, it's not the kid's fault. So I agree with feeding those kids lunches. But other than that, for the life of me, I cannot see what Wab Kinew has done for Manitoba. So here's some other crazy news. I hope everyone, this should be not along political lines, everyone should get on board with this, stopping this, because if we don't, all the other problems I talk about are just exacerbated. The drugs will become more of a problem in Manitoba because obviously people smuggle drugs across borders, and our healthcare in Manitoba will continue to struggle if we don't stop human smuggling. And obviously, as soon as I talked about the First Nations lady who got zip tied at the Marlborough Hotel, everyone was so fast to point out that Winnipeg is a hub for sex trafficking. Well, that is another problem that comes with illegal border crossing. So all negatives can be targeted through the stopping of human smuggling. But I mean, again, Wab Kinew will say what you want to hear, and there'll be no follow through. But either way, from Winnipeg Sun, Calgary man busted for human smuggling after illegal border crossing at Emerson. A 49-year-old from Calgary has been charged with human smuggling after 7 men attempted to illegally cross into Canada, illegally cross the Canada-U.S. border near Emerson last month. The individuals were noted to be wearing proper winter clothing, that's a plus, and likely to cross into Canada within the hour. RCP said officers from IBET attended to the area and conducted a traffic stop on a vehicle located at the intersection of PR 201 and PR 200 near Dominion City, which was registered to a rental car company. The vehicle contained a male driver and 7 male occupants aged 49, 44, 37, 34, 33, 28, and 27, who were confirmed to be foreign nationals from the Republic of Chad. The 49-year-old driver from Calgary was arrested for human smuggling under the Immigration and Refugee Protection Act and remanded into custody, where he appeared in court in Winnipeg on January 29th. That is mind-blowing, Manitoba, that he was remanded into custody. Wow. The other seven individuals were arrested under the Customs Act and turned over to Canada Border Services Agency immigration officers at the Emerson Port of Entry. RCMP, along with the Canada Border Service Agency, continue to investigate. So that's crazy, Manitoba. Human smuggling at the border. This is not something new. Last winter, there was, unfortunately, people died trying to cross the border. They weren't wearing any sort of winter clothing, unfortunately. And last year, if you guys remember, we had like minus 40 winter, so that was fucking insane. But either way, Manitoba, thank you guys for joining me again. I just want to point out to you, because the mainstream media won't, that Wab Kinew and the NDP party, like I said, just continually, they just talk, but they don't have any follow through. And unfortunately, we're stuck with them for 3 more years and 8 more months. 3 years, 8 more months of this. Of saying one thing in front of the cameras and doing the exact opposite. But Manitoba, I guess we get what we voted for, right? We get what we deserve. I don't know, Manitoba. Either way, love you guys, and I'm probably gonna come back on Thursday. I think I'm